Yeah. Well, good morning. Thanks for being here, and of course, it's a pleasure to welcome you to the Labor, Health, Human Services, and Education Subcommittee on Appropriations, and look forward to taking testimony from members this morning. It's an opportunity, of course, for us to hear directly from members as we want to hear what's important to them and the congressional districts they represent. And I appreciate Mr. McGovern being here. I've been before his committee before, so it's actually good to be on the other side of the mic. So, but you're welcome here, and we look forward to hearing from you. And before I begin, I will turn over to Mr. Pocan, who is sitting in for the ranking member, for any remarks that he would like to make.
Thank you, Chairman Adderholt, for holding the Member Day hearing. As this is the largest non-defense appropriations bill, the subcommittee allocates approximately $225 billion in annual funding. The programs in this bill fund life-saving biomedical research. They equip our nation to deal with public health emergencies. They level the playing field for low-income children looking to get a good education, and they help Americans get the skills they need to find a job. I could go on, and I'm not going to. These programs directly impact the lives of Americans across the country, especially children, families, and seniors. So as the subcommittee begins to draft a new bill for fiscal year 2025, it's important we hear from our colleagues on their top priorities. Thank you for doing this, Mr. Chairman. I yield back.
Thank you, Mr. Pocan. I'd like to now recognize our first witness, Mr. McGovern.
Well, thank you, Chairman Adderholt, and my friend, Mr. Pocan. Thank you so much, and members of this committee. Thank you for the opportunity that gives me the opportunity to testify today on some of my priorities for the FY 2024 for Labor, Health and Human Services, Education, and Related Agencies Appropriation Act. And let me thank the members of this committee for the time and the effort you put into these bills, and to the staff in particular. I mean, this is a lot of work, and just know that some of us are grateful for all of your efforts. Look, we hold in our power the ability to lower diet-related disease, improve health outcomes, and lower healthcare spending. Food is medicine, and we can do all of these things by better incorporating nutrition in our healthcare. A bipartisan group of members, including my dear friend Barbara Lee, who serves on this subcommittee, have authored a request for funding and report language directing the Department of Health and Human Services to advance this work as outlined in the 2022 National Strategy on Hunger, Nutrition, and Health. The letter calls upon this subcommittee to increase funding for the Office of Nutrition Research at NIH, including support for the Food as Medicine Centers of Excellence. We are also asking for $5 million to continue the incredible work at HHS to implement the national strategy and to establish a knowledge hub that will collaborate with other federal departments to craft best practices, tools, and guidance to advance food as medicine initiatives nationwide. Additionally, we are requesting report language to improve medical nutrition education for doctors, better incorporate medically tailored meals and produce prescriptions into our current healthcare programs, and provide technical assistance to states seeking to expand their food as medicine work under the Medicaid 1115 waiver. Taken together, these advancements would dramatically scale up food as medicine work happening within the U.S. government and across the country, helping to save lives, improve nutrition, and lower healthcare costs. I want to thank you for the committee's longstanding support for the Innovative Approaches to Literacy grant program, which is authorized in the Every Student Succeeds Act and administered by the Department of Education. The Innovative Approaches to Literacy grant program has awarded over 200 grants to nonprofits and school districts around the country since its creation in FY 2012. IAL grants provide access to literacy, community-based literacy programs for students in low-income and underserved communities. Given the emerging evidence of pandemic-related learning loss, bolstering programs to support children's literacy is more important now than ever. And I ask the committee to maintain its historic commitment to this program and prioritize funding for the IAL grant program. In addition to my general support for IAL grants, I want to express my specific support for those grants that go to programs that support pediatric literacy programs that are provided during well child visits by medical providers trained in research-based methods of early language and literacy. Reach Out and Read, the only national pediatric literacy model endorsed by the American Academy of Pediatrics, reaches 4.4 million children across every state, and in Massachusetts' 2nd Congressional District, which I represent, Reach Out and Read has 42 sites and 361 participating providers. And I ask the committee to support language that encourages the Department of Education to use a portion of the funds appropriated for IAL grants to support pediatric literacy programs. I'd also like to highlight the importance of supporting additional health-related requests. I ask that the committee support language that increases funding for mitochondrial disease research and prioritizes the development of life-saving therapeutics. I ask the committee to support language directing the NIH to allocate funding for research and awareness grants relating to childhood post-infectious neuroimmune disorders, such as pediatric acute onset neuropsychiatric syndrome and pediatric autoimmune neuropsychiatric disorders associated with streptococcus. I also ask the committee to support language that encourages ARPA-H to provide continued funding for the Investor Catalyst Hub and Spoke Network, and language that encourages the National Institute of Biomedical Imaging and Bioengineering to continue to expand the innovation funnel model beyond COVID-19 testing to address other critical unmet needs in diagnostic testing. I provide further details of the importance of these 4 requests and written testimony that I'm submitting today. And lastly, I'm grateful for the committee's previous support of neurofibromatosis research. As you craft the next appropriations bill, I ask that the committee continue to consider the Americans suffering from this disease and include report language in the Office of the Director account encouraging various institutes at NIH to continue to expand their NF research portfolios. I'll just say, finally, this is particularly personal to me. I have a daughter who's 22 who suffers from neurofibromatosis, which has developed into a cancer, which she is being treated for right now in a clinical trial. But she is making progress in large part due to the investments that we have made at NIH that have produced some breakthroughs, and my hope is that it will ultimately lead to her cure. So I appreciate your patience, and I will end there.
Thank you. Thanks for your information about those particular projects and those particular programs that, and especially for mentioning your daughter with the NIH funding. I know that y'all have been through a process with that, and we certainly will keep her in our thoughts and prayers as we move forward. But certainly we are glad that that has been beneficial to her there at NIH. So with that, do you have any questions or anything from the ranking member? Okay.
And thank you. And I'll
Those 2 pages are
and
not.
Thank you, and I'll remember this courtesy when you come to rules.
Yes.
All right.
Well, thank you. Good to have you here. Thanks so much. Okay, our next witness will be Representative Ruiz, and from the great state of California, 25th District, and we look forward to hearing your testimony this morning about some projects or programs that are of special interest to you.
Thank you very much, Mr. Chairman. As an emergency physician, I worked hand in hand with infectious disease physicians on the H1N1 response, and I appreciate from firsthand experience the critical role that ID physicians played in our responses to COVID-19 and Mpox. As we've heard time and time again in the Select Subcommittee on the Coronavirus Pandemic, where I serve as ranking member, outbreaks and pandemics will be more frequent in our increasingly interconnected world, and it is critical that we ensure all of our communities have the ID workforce they need to prepare and respond. ID physicians are critical to care for patients with serious infections, to develop and lead infection prevention protocols that keep our health care facilities safe, to collaborate with public health officials on investigations and surveillance, and to conduct research, including clinical trials for medical countermeasures. Patients with serious infections who are cared for by an ID physicians have better outcomes, shorter hospital stays, and lower healthcare costs. But nearly 80% of counties in our country do not have a single ID physician. And last year, only 50.8% of ID physician training programs in the U.S. filled, down from 56% in 2022. Hospitals across my state of California aimed to recruit 35 new ID physician trainees last year, but were only able to recruit 24. ID faces a unique recruitment barrier because our healthcare system does not adequately value ID physicians' expertise. According to Medscape, ID has the third lowest reimbursement of all specialties. High medical student debt understandably drives many new physicians to higher remunerated specialties, leaving our communities without the ID experts we need to be resilient in the face of the next outbreak or pandemic. That is why I'm asking the subcommittee to provide funding for the Biopreparedness Workforce Pilot Program at HRSA, which was authorized at the end of 2022 and has not yet been funded. The pilot will incentivize health professionals to pursue careers in ID and biopreparedness and to work in communities where they are most needed. No federal programs offered loan repayment for providing ID care or conducting emergency preparedness activities in healthcare facilities prior to the establishment of the pilot program. This program fills a discrete but critical need without duplication of federal resources. So with respect to healthcare workforce shortages generally and other barriers to accessing care, rural communities like the congressional district I represent are disproportionately affected and need additional resources to ensure access to care. According to the Health and Human Services Administration, over half of designated health professional shortage areas were rural. Additionally, many rural hospitals are under-resourced and are at risk of closure, putting vital healthcare services for the community in jeopardy. That is why I'm urging the subcommittee to support funding for rural healthcare programs in this year's funding bill, including the CDC Office of Rural Health, the Small Hospital Improvement Program, or SHIP, the Rural Residency Planning and Development Program, the Rural Maternity and Obstetric Management Strategies Program, and the Rural Communities Opioid Response Program. These programs are instrumental to bolstering the healthcare infrastructure in rural communities. Thank you, and I yield back.
Thank you, Ms. Ruiz, for your testimony here, and I'll defer to the ranking member if he has anything. Well, again, thank you for calling this attention. My cousin husband was a infectious disease physician over at Johns Hopkins, and so I understand the importance of infectious disease, and especially after the pandemic last year, understand the importance of making sure that infectious disease is something that we pay close attention to. So thanks for calling that attention to the subcommittee, and we look forward to working with you on this. Thank you. If there's no other and no other comments, then we stand adjourned.